Hi, my name's Mary Brady. I'm going to be doing my female urinary catheterization skill. I have my order here, patient Mary Smith, date of birth 427XX. She's 45 years old, female, and she has no allergies. My order reads intermittent straight urinary catheter insertion, female. If the client has not voided within 4 hours, use bladder scanner to check residual amount. If residual is greater than 200 milliliters, then perform intermittent urinary catheterization. My patient, Mary Smith, has not voided in 4 hours, so I did a bladder scan. Her residual came up greater than 200, so we're going to do the catheter. So I'm going to go see my patient. Hi, my name's Mary Brady. I'm going to be your nurse today. Can you tell me your name and birthday? Mary Smith, her armband here, Mary Smith, date of birth 427XX. She's 45 years old. Mary, do you have any allergies? No allergies, great. So I am going to wash my hands. Mary, so I know that you've had trouble voiding and you haven't peed in about 4 hours. So we did the bladder scan. You do have more than 200 milliliters of urine in your bladder. So we're going to do what's called a straight cath. I'm going to insert a tube into your bladder. We're going to hold it there until the urine stops coming out, and then I'm going to remove that. Do you have any questions? No questions? Great. So now I'm going to stand up here. I would help my patient into position, dorsal recumbent position, or help her butterfly her legs. Wash my hands one more time before I start now. I'm going to put on clean gloves. I'm going to flip up her drape here, but still provide as much privacy as possible. I'm going to use, I have tissues here as peri wipes. I'm going to wipe the furthest one away, discard that. Wipe close to me, throw that away, and then wipe right down the center. I will take my gloves off here and rewash my hands. Now I'm going to check my kit. Normally it should be closed, but mine's open. But my expiration date is good. And I have my sterile gloves here. So I'm going to wash my hands one more time. Open my kit here. Keep the paper for documenting later. And I'm going to use sterile technique to open my kit. Only touching the edges. I'm going to remove the blue drape here. Only touching the edges again. I would place the shiny side down, and I'm going to have Mary lift up her butt and place that under her. And I'm going to open my sterile gloves. Alright, so I've maintained the sterile field. I only touched the edges. Everything's ready. I'm going to rewash my hands. I'm going to try to show you here. Only touching the inside. Have my fingers in the cuff to put my next glove on. Alright, so my gloves are sterile. Now I'm going to set up. I'm going to take my betadine swabs, open those. Take my lube, remove the cap there, and I'm going to lubricate the tip of my catheter about 2 to 3 inches to the top. Throw that away. All right, now I'm still sterile and I'm ready to start. I'm gonna move my kit here onto the blue drape. I'm going to take my non-dominant left hand. I'm going to spread the labia. I'll take my first swab here, clean furthest from me, discard the swab. Clean closest to me, discard that swab. With the final swab, I would clean directly down the middle in the meatus. Now I'm going to take the catheter here. I'm going to make sure that my end stays in the receptacle. I'm going to insert the catheter into the urethra about 2 to 3 inches. I'm going to insert it until I get urine return. Then I'm going to hold it there till the urine stops. Then I would remove the catheter, clean up, get rid of that, take the dressing and wipe as best as I can. And I can let go there. I am going to take my gloves off. Discard that. Wash my hands again. Fix Mary Smith's drape here. And then before I finish, I'm going to wash my hand. I'm going to make sure Mary's safe, in a comfortable position, ask her if she needs anything, and then I'm going to go and document. Just before I go, I wanted to to say that we were in a private room the whole time, so she had privacy that way as well. Thank you.